Subcutaneous injections are an important part of nursing practice and a skill that every nurse must learn. This program will identify supplies needed for giving subcutaneous injections, illustrate landmarks for sites used, and show techniques for giving these injections. Subcutaneous injections are given into the tissue between the dermal and muscle layers, wherever there is subcutaneous tissue. This route is typically used to administer medications that require slow absorption.
Subcutaneous tissue contains fewer blood vessels than muscle tissue. Therefore, medications given subcutaneously absorb slower than medications given intramuscularly and absorb faster than medications given orally. Up to 1 milliliter of medication can be given subcutaneously. Common medications are insulin, anticoagulants, epinephrine, allergy medications, and some immunizations. Decontaminate hands before and after the procedure using acceptable aseptic practice as indicated by agency policy. Gloves also should be used. Follow the 6 rights of medication administration: right patient, right medication, right dose, right route, right time, and right documentation. Supplies necessary for a subcutaneous injection include safety needle and syringe, alcohol pad, bandage, cotton ball, gloves, and appropriate medication. Needle gauges for subcutaneous injections range from 25 to 30 gauge. Needle gauge is determined by viscosity of the medication being administered. Needle lengths range from 3/8 to 7/8 inch. Length depends on the amount of subcutaneous tissue present. Most subcutaneous syringes range from 1 to 3 milliliters. Medications may come as prepared syringes for subcutaneous administration. Examples are anticoagulants, insulin, and epinephrine. An insulin syringe is calibrated in units. The amount of subcutaneous tissue present is important for determining both needle length and angle of injection. Needle length should be about 1/2 of the pinched tissue top to bottom. If 1 inch is pinched, use a needle in the range of 3/8 to 5/8 inch at 45 degrees. If 2 inches are pinched, use a needle in the range of 1/2 to 7/8 inch at 90 degrees. A needle longer than 7/8 inch should never be used. A subcutaneous injection deposits medication into the subcutaneous tissue. The subcutaneous tissue typically has fewer blood vessels than muscle. Sites for subcutaneous injections are the vascular areas of the outer aspect of the upper arm, the abdomen, the anterior aspects of the thighs, the scapular region of the upper back, and the upper ventral or dorsal gluteal areas. The site should be free of any lesions, bruises, scarring, or conditions that may interfere with absorption. If the patient is thin and subcutaneous tissue is limited, the upper abdomen is a good choice for the injection. For consistent drug absorption, it is recommended to choose one anatomical area and rotate sites within that area before moving on to another anatomical area. Multiple injections in one site can result in complications such as tissue hypertrophy. Two injections will be demonstrated, one in the arm and one in the abdomen. Verify medication orders and patient allergies. Assemble supplies and medication. Draw up the medication. For this patient, 1 inch of tissue will be pinched. The injection will be given at a 45-degree angle using a 27 gauge 5/8 inch needle. Locate the landmarks, the posterior aspect of the upper arm, and choose the injection site. Explain the procedure to the patient.
Todd, I'm going to give you your allergy shot today. Dr. Maxter's ordered just a little bit stronger dose, so we'll see how that goes.
Clean the site with an alcohol pad using a circular motion moving outward. Allow the alcohol to dry. Using a smooth darting motion, inject the needle into the base of the pinched tissue. Release the pinched tissue, stabilize, and inject the medication. Withdraw the needle quickly at the same angle as inserted. Cover the injection site with a cotton ball or alcohol pad. Gently massage the site to help distribute the medication unless contraindicated. Do not massage the site when injecting anticoagulants or insulin. Safely dispose of the needle and syringe according to agency policy.
We're all done, Todd. How are you feeling?
Feeling just fine.
Good. Okay, we'll want you to stick around for a little while just to make sure that we don't have any reactions to this. You've been lucky so far.
Dispose of used supplies. For this demonstration, 2 inches of tissue will be pinched and the injection will be given at 90 degrees. A 25 gauge 5/8 inch needle is selected. Verify orders and assemble supplies and medication. Drop the medication. Locate the landmarks.
Rick, I'm going to give your injection to you in your stomach today.
The abdomen below the costal margins to the iliac crest, 2 inches out from the umbilicus. Locate the site. Clean with alcohol.
This might be a little cold. I'm going to clean it off first.
Allow to dry. Pinch the tissue.
Okay, you're going to feel a sharp little prick.
Use a smooth darting action to insert the needle at a 90-degree angle in the middle of the pinch. Release the pinched tissue, stabilize the syringe, and inject the medication. Withdraw the needle, cover the site, and massage. Safely dispose of the syringe.
All right, let's see what that looks like now. Put a little Band-Aid on that. Good. There you are. All done now. You can go ahead and get dressed.
Discard used equipment. On the correct patient record, document the procedure. Indicate time, medication, dose, route, site, and any adverse reactions or complications. The medication administration record, or MAR, is initialed or signed by the nurse administering the medication.
The amount of subcutaneous tissue, site rotation, needle length, and needle gauge are all important considerations when giving subcutaneous injections. Follow your agency's policies and procedures when administering and documenting subcutaneous injections.